Welcome back to the bill breakdown. Today we're covering Senate Bill 25-270. SB25-270 restructures the way Colorado collects fees from nursing and intermediate care facilities. It eliminates existing fee systems and shifts these fees to be collected by Chase, Colorado Healthcare Affordability and Sustainability Enterprise, starting May 1st, 2025. Chase will then use these fees to provide business services, boost Medicare and Medicaid, reimbursement rates, and allocate supplemental payments to facilities. A new board within Chase oversees this change, and the new fee system is TABOR exempt, meaning it doesn't count against Colorado's constitutional spending limits. Roughly $63 million from nursing facility fees and $2.1 million from intermediate care facility fees are redirected. But since they're exempt, they won't require refund obligations under TABOR. The state will also spend about $10.1 million in the 2025 and 2026 fiscal year for property tax reimbursements due to the shift. So why is there so much conservative backlash on this one? Well, primarily because it bypasses the Taxpayer Bill of Rights, or TABOR. The bill uses the enterprise model to sidestep taxpayer protections under TABOR, effectively allowing lawmakers to move money without voter approval. It also expands government control. It grants Chase, a state entity, more authority over private healthcare businesses, raising red flags about increased bureaucracy and interference. On top of this, there's the business impact and costs. Nursing facilities are forced to pay new fees and adhere to Chase's service requirements, raising operational complexity and costs. Smaller facilities may also struggle with the added administrative burden, potentially affecting your quality of care or forcing closures. Although fees are shifted off TABOR, the state still appropriates $10 million in general funds to cover the related property tax effects, meaning taxpayers foot the bill anyway. There's also a lack of oversight and accountability. The new Chase board is unelected and relatively unaccountable to voters, granting power without any democratic checks. So why is this bad policy? Well, primarily, it undermines taxpayer protections. By working around TABOR, the bill limits what voters can influence in future budgets. It also inflates government control. It centralizes authority over private, nonprofit, and community health facilities. And it hammers small providers, putting profit-straining fees and compliance burdens on smaller-scale care centers. Potential for unintended costs. Even though exempt, there are still significant impacts on state spending and property taxes. There's also a democratic deficit. It gives unelected officials more power over critical public services. Here's the breakdown. Senate Bill 25-270 rearranges how nursing and care facility fees are collected, moving them into a state-controlled TABOR-exempt enterprise. Conservatively, it's seen as a backdoor expansion of state power, adding cost and bureaucratic stress to healthcare providers and weakening Colorado's constitutional safeguard on taxpayer oversight.